Hello, this is Dr. Gay from First Look MRI, and this is a 39-year-old male who complains of a growing mass in the medial aspect of the ankle. It's been present about 2 months, and the patient went to see their doctor and they requested an MRI to see what is going on. We have two images here from the same orientation. This is called a fat-suppressed T2 weighted image, and on a fat-suppressed image, all the marrow is dark because marrow has fat in it. All the subcutaneous fat is dark. And the only thing that stands out bright are fluid collections or pathology. Sometimes veins will be bright too. These little strings of brightness are veins. But we see right here, this is one of the problems, a septated area of brightness right here. There's also a little component of it over here on the lateral aspect of the ankle. Now in this one, there's no fat suppression. This is called a T1 view. So T1 views, marrow is bright, subcutaneous fat is bright, and fluid and pathology are often dark. So this is dark on this one. You can see T2, T1 weighted image, how different they are. This area over here doesn't really show up very well in the T1 images, but it shows up pretty good here on these T2 weighted images. And over here we can see a marker which has been placed over the skin. It's indenting or tinting the skin here, and that indicates where he's feeling that palpable abnormality. And sure enough, it's right there over this area that's abnormal. So the question is, what is this thing? We see that it is complex, multiseptated. See little whirling areas of intermediate signal intensity that are septations. It goes from the medial aspect here. This is in the region of what we call the tarsal tunnel. It goes through this area called the sinus tarsi, and it looks like it protrudes out here on the lateral side. So it looks like it's one big, continuous, complex structure. Now if we change to different orientations here, we can see this is a sagittal view looking in profile. This is an axial view. This is the front of the foot. Here's the heel and back. And this is the inner side or medial side here. And we see this prominent, complex area right here that's bright. This is the outside lateral component. Looks like it goes right through the middle, through a channel here, and comes out here on this side. So this is called the tarsal tunnel. The tarsal tunnel has some vascular structures over here. There's a little dark rounded area there. That's the posterior tibial artery, that dark area with fast flowing blood. And the little bright things around the periphery, these 3 or 4 little bright dots, those are the veins surrounding it. And behind that, there's another dark area here. This is a nerve, the tibial nerve. So these are the neurovascular structures, or the neurovascular bundle that goes through this tarsal tunnel. So this is again a complex, looks like partially fluid signal intensity structure that goes into the tarsal tunnel. It looks like it goes through the sinus tarsi here, laterally. Now in this side view here, the sagittal view, we see the big medial component here, and this is the sinus tarsi here. It looks like it's in the top of the sinus tarsi, and going through here to the lateral side again. So the question is, well, what is this thing? So in a foot in a patient who's fairly young like this, 39 years old, when we see anything complex that looks like a fluid collection, it's so bright, it looks like a ganglion cyst, and it still could be a ganglion cyst, but it's very bright, and there are a lot of septations. So what this could be is a synovial sarcoma, which is a malignancy. They are very bright. They look just like they contain fluid, but it may just be bright synovial cells that mimic the appearance of ganglion cysts. So in this patient, we need to do IV contrast to see if these things enhance. And either way, this needs to be removed and make sure this is not a synovial sarcoma, again, which it may be. So this is, again, a 39-year-old male in a prominent septated thing that looks like a fluid collection, but again, this may be a synovial sarcoma, and the possibility of a complex ganglion cyst is also there, but they're going to have to do IV contrast and eventual surgery to make or to decide what this is. But that's it. Thank you very much.